Hi, my name is Fred Page, and I'm presenting my final innovation project for our Population Global Health class on the implementation of the nurse-led education for PrEP, pre-exposure prophylaxis, medication adherence. A little introduction about what I'm going to be discussing. I'm going to briefly talk about the HIV and AIDS epidemic, a reason why PrEP actually is an innovation that was created by CDC and approved by the FDA to help combat the HIV virus, and as well as some treatment options and information technology and how the overall impact of nurse education comes into play into the healthcare setting. A little bit of background about the HIV and AIDS epidemic. It began in 1981, that evolved from the late 1960s, but the first mysterious case reported in the USA was in 1981 when five individuals, homosexual individuals, became ill who were previously known to be healthy. They basically were diagnosed with pneumocystic corona pneumonia. So basically, they pretty much their condition had transmitted through sexual contact, and also too was figured out that the infectious agent could be transmitted by blood as well. These individuals became rapidly ill with deteriorating health, and that's pretty much how doctors pretty much became to decipher. Actually, this is a mysterious case that had appeared in the USA, and it affected certain individuals. So this high-risk population list has evolved from 1981 up to now to 2026, where we are today. Injection drug users, African Americans, youth aged 13 to 24 years old, people who have a history of sexually transmitted diseases, and the group LGBTQI, and there's no known effective treatment for it. So basically, for now, HIV is actually treatable, but it's not cured. The prevalence rate of people living with HIV in the United States, these numbers are for 2022 due to According Research. It's a couple years behind. There are about approximately 1.2 million here in the US living with HIV, and about 13% of that numbers is undiagnosed. New infections account for 31,800 of that 1.2 million, and the new infection rate is 11.3 per 100,000 people. And a large percentage of the regional concentration is in the South, ranging at about 47%. A little bit more about the prevalence rate. The age group is a 13 and older, range about 37,981 people. And the relevance has decreased since 2018 up to 2022 by 12%. The transmission rates range people male to male sexual contact. It ranges at about 67%, which is the highest. Heterosexual contact at 22%, and injection drug use at 7%. And a little bit about the ages. Age 60 years and older, about 45%, and African Americans at a number of 438,749, and Hispanic and Latino Americans at 302, 143,000 for three people. A little bit about PrEP. PrEP stands for Pre-Exposure Prophylaxis. It is a regimen for people who can receive treatment to lessen their chances of contracting HIV. It's basically for the high-risk individuals that I had named. So basically, they can actually lessen their chances of, if they do come in contact with the virus through sexual contact, they can lessen their chances by 99% efficacy, and also to injectable drug use by at least 74%. It requires to remain on PrEP and to remain compliant. You have to check in every 3 months, check-in visits to where you receive HIV testing, and you have to remain negative or to stay on. And so if you do test positive for a sexually transmitted infection, you can receive treatment for that as well, which is a good thing for people who are high risk. Also, some insurances do allow medication pickup every 30 days. So that is a requirement as well, or some require 90 days, so every 3 months. So that is something as well for people to pick up for remaining compliant on PrEP. And PrEP is not a free ticket for people to have sex without condoms, because PrEP does not protect you against STIs. You can still remain high risk for that. So therefore, consistent condom usage is recommended. Treatment options for PrEP. It is an antiretroviral therapy, ART, which are HIV drugs that actually treat HIV. And it's a combination of medications, and the combination can be oral or injectable. Truvada and Descovy are the two oral forms, and Apretude and lenacapavir are the two injectable forms. Basically, the innovation for this in actually combating PrEP is not actually widely, it's widely it's widely heard of, but it's not widely used. So therefore, nurse-led education actually is underannounced for the most part. It basically can help provide holistic care of the patient from upon arrival and throughout the enrollment and participation of PrEP. So basically, patient compliance can improve by, it has been proven by modern research in the past that nurses being involved in the care of the patient for its intake, testing them, providing treatment, which is something that they do anyway. So therefore, they're actually the lead way of actually guiding the person, providing more information about PrEP, how it can affect their health, how it actually can help them remain negative, and being according to certain, also identify and educate them on high risk factors. And basically, our nurses also operating within their medical scope by educating, treating, and assessing their patients. And also, too, it can actually establish an ongoing relationship between the nurse and the patient. Patients can actually feel basically like they're actually a part or actually cared for. So therefore, that can help improve PrEP enrollment and also adherence. So if a person has questions about something, they can reach out to that nurse, and a nurse can lead them and guide them in a way that they don't have to worry about having to talk to certain individuals. They can talk directly to the nurse. Information technology as it pertains to PrEP. Basically, they have tried and actually innovated, automated, and like personalized interventions for like pretty much a dot diary, pretty much where it reminds the person to take their medications. And it basically sends them reminders digitally through an app, and also to electronic medication monitor. Basically, it's monitoring um, how often and how frequent they're taking their medications, and also too with the electronic health record, the data driven personalization aspect of it. Basically, of course, that's a person's chart. It basically identifies whether a person have been compliant with their visits, and also too they have it digitally now to where a person, when a prescription is actually administered or wrote for a patient, it goes in their chart whether they pick it up in on site, where they see a clinic, wherever they pick up it automatically, that pharmacy automatically notifies that medical record or that center that the person has picked up their medication and how often. And virtual care and counseling, basically like telehealth. We all know about telehealth now. Basically, the technology aspect doesn't require a person to come in to basically where they might have issues with transportation. And so, therefore, the nurse can counsel them and speak with them virtually and get them what they need in a timely fashion. And also, too, it automatically gives educational counseling. So, therefore, information can be shared through emails or whether they can be shared through their chart. Ethical considerations related to this innovation. Far as privacy, confidentiality, of course, we know, far as with HIPAA, we have to keep everything private, and therefore it decreases a person actually having a lot of stigma. Stigma is a lot of stigma behind PrEP, and so therefore PrEP information can actually help alleviate some of that stress for a person. So therefore, they let them know the information actually is kept safe and confidential. No one knows about what they're being seen for. And also to the informed consent, a person actually is given a site or a center permission to see them and to treat them, as well as to remain ongoing for us to contact with them. And also data security and integrity. Basically, in order to prevent any hacking and data breaches, for the most part, the system must adhere to all applicable rules. Like I said, it deals with HIPAA and things like that. And more ethical considerations, far as justice and equity, it prevent health disparities from becoming worse. Basically, with HIV, we're actually trying to decrease those cases because new cases are still on the rise. Like in the state of Mississippi, it has been labeled as the number one. It's always been in the top five for the past several years. So basically, with PrEP being in use, it actually can help alleviate that burden of the state, and as well as to keep the numbers low, and also to the education can be basically for people underserved, like the lows of people of low income or poverty are restricted to access technology. It's actually you have to take those considerations as well. And minimizing the stigma and non-maleficence. Data sharing strategies should be safeguarded for users. So basically, they're personalized. It shouldn't be shared any type of way, basically dealing with the stigma as well. It shouldn't be shared in a type of way that's not conducive for a person's health. And de-identification. And basically, no correlating information actually is being shared with anyone that's pertaining to a particular patient and what they're being seen for. Essential leadership skills for this project: developing planning, basically designing planning, visioning for health equity, for the most part, to enhance the acceptance of PrEP. Like I said, PrEP is not widely known. It's basically among the disadvantaged populations, people who live in poverty, and identify the gaps. Like in Mississippi, it's a low income state, it's like the lowest in the country. So therefore, the gaps in prevention needs to be addressed. This basic nurse education can actually reach out to individuals or actually help close the gap with having access to PrEP and other services and evidence-based practices for the most part. Basically, keeping up with current practices and things like that. Like for instance, the CDC has recommended that patients can, as long as they pick up their medications, they can come in every 6 months versus every 3 months, and interprofessional collaboration. Basically, therapeutic pathways amongst the whole board, across the board, to where pharmacists, social workers, and physicians and other providers actually are on the same page in treating the patient. And implementation, action and execution, basically leading change by encouraging a spirit of exploration and calculated risk taking, may shift from patient physician centered to a nurse led style, to where the nurses actually in head up, they're in contact with the mid level providers and the physicians, but therefore they are in charge or in lead the way of the care. And coaching and educating can build confidence with your actual patients, and as well as other staff can help counsel or actually bridge the gap with PrEP services being rendered at facilities. And patient advocacy and cultural humility, basically addressing HIV and trying to destigmatize the situation, and also to try to provide cultural humility. So basically, across the board, no one is actually left out. You actually address all aspects of human life, all different cultures, ethnicities, and everybody's included. And evaluation with the assessment and monitoring, the analytical thinking and data evaluation. Basically, you're measuring your success of the program. Basically, how nurse-led education, um, how nurse-led education affects how nurse-led education affects um, how nurse-led education affects that. And lastly, it would be your evaluation of the program as well. So therefore, you evaluate everything in overall and a total to pretty much see how nurse-led education actually can be efficient in actually reaching your patients and things like that. I apologize, I skipped over the slide. Far as a summary though, modern medicine, the efficacy, as you can see with PrEP, it is effective if a person take the medication every day if they're actually high risk for sexual contact, and at least 74% with injection drug users. PrEP is slow. Like I said, I can't stress that enough. PrEP is widely, I guess, uh, known that it can be used, but it's uneven in the U.S. Other countries outside the U.S., they seem to have good efficacy with it because they do push it, they do use it, and nurse education is globally being used as well. So universally, it's being known to actually help advance modern sciences and far as how things are going. And I do thank you. That concludes my presentation. Thank you for watching and listening. And here are my references. Thank you.